Hello, everyone. My name is Dovilė Šorytė, and I am very happy to start this discussion about nature and how that connects to our mental health and well-being. And I would like to start our discussion from a few short evidence-based examples that we have from research. So, according to one study, an outdoor learning program improved children's well-being in terms of their health, learning, general mood, and feelings about self. Another research showed that forest therapy reduced depressive symptoms in patients diagnosed with depression. And one more example, residential green space presence in childhood is associated with a lower risk of a wide spectrum of psychiatric disorders later in life. So these are only very few examples from a really vast and extensive evidence that we have in this topic. And despite that, we still see nature too often through the lens of resource use and too little through this perspective of health promotion. And that's why we have this discussion today to really discuss how to better integrate nature to support people's mental well-being and what changes do we need to achieve this. And I'm really, really happy to have this group of panelists here today with me. And we have panelists join the discussion, Dr. María Pálsdóttir, who is an associate professor and senior lecturer at the Swedish University of Agricultural Sciences, specializing in environmental psychology and nature-based interventions. Hello. Austė Juozapaitytė Gruodė, environmentalist coordinator of the Gyvo Žalio Association, creator of nature-based experiences and a forest therapy guide, who also lectures for the nature therapy program. Hi. Dr. Gintarė Tamašauskaitė Janicke, who is a scientist and nature connection practitioner. She's an expert in interdisciplinary social research, covering diverse areas, including the integration of nature and forest therapy into research and practice. Hello. And Gintarė Karelina, an ecologist and a forest therapy guide, working as a nature management specialist at the Lithuanian State Forest Enterprise. And Gintarė currently coordinates forest therapy experiential activities at the enterprise. Hi. And I myself am environmental psychology researcher. And today here I represent environmental psychology group at the Lithuanian Psychological Association. And the audience participation is very, very welcome. So please think about the questions for our panelists, and we will have time for the questions and answers at the end of the discussion. So to start, I would like to start from a very general question for all of you. How do you yourselves experience nature exposure? How does it affect your mood, your mind, your emotions? Please share your own experience. Gintarė, can we start from you?
Yeah, so thank you very much for the invitation to be here today. The topic is very important and about personal experience. So I could say that the nature is with me from the childhood. I was very happy child because my parents provide me to have freedom in the nature. So I'm very grateful for my parents for this experience. And now the nature for me is like part of my life, of my work. Also it's a source of creativity, of my personal values, inspirator, and for me it's like every day I receive support from nature, especially when I need to less stress level. So it's very helpful. And today in advance I received permission from our moderator Dovilė to invite all of us just to try not by talking, but starting by doing something. And I would like invite you, all of us, for short nature therapy mindfulness based practice, and to become like a tree for a short time. Okay. I invite you to pause for the moment. Find a comfortable position, sitting or standing. And if it feels safe, gently close your eyes. Take a slow breath in and out. Once more, breathe in and out. Now, bring your attention to your feet. Imagine they are roots reaching deep into the earth. With each inhale, they are nourished. With each exhale, they grow, grounding you. Your body is the trunk of the tree, strong, steady, holding you upright, and yet flexible enough to move with the winds of life. Maybe you could hear some voices of people, but you can choose yourself to hear what you want to hear at this moment more. Maybe the river, wind, birds, other trees, or just feel fresh air around you. Your arms are like branches. If you like, you may gently open or lift them. Imagine then reaching upward, open to the light, absorbing the sky, the sun, the air. Each breath in draws in light, vitality, energy. Each breath out lets go of what you no longer need. Like leaves softly carried away by the autumn breeze. Take a few moments to simply rest in this feeling of being a tree, rooted, strong, alive. And now, when you are ready, take one deep breath in and out. Gently bring your awareness back to the space around you. Feel the ground beneath your feet. And when the moment feels right, open your eyes, please. Carry with you this sense of calm.
Thanks so much, Gintare. That's really good experiential introduction to our topic. Thank you. Austin, what about you? How nature exposure allows you to feel?
Nature is my everyday life, from work to just days after work, weekends, and so on. Sometimes it's nearby computer, working about the nature, but nature for me is a recharger. When I am tired, for example, now I have long week, long work hours, and yet I am come here to this park and I feel a bit recharged now. Like for me it's like energy drink, you know, it's very fast. I don't know if you all experience that when you come from the city to the nature, how long it takes for you to recharge, but for me it's very, very fast, like 20 minutes, and I feel a bit recharged. But I see that we still have some lessons to learn. So if Gintare invited you for a short meditation, I invite you to use this time that we are more or less in nature, and if you feel comfortable to take off your shoes, because when you listen to us for 1 hour, you will be recharging, you know, putting your feet on the ground. So don't hesitate, it's grass, it's very soft, very nice grass, warm weather, so I really recommend it, because after few minutes, your feet on the grass, you will feel recharged. So yeah, then you will feel what I feel in a few minutes.
Thanks, Asta. Yes, Anna Maria.
What was the question again? Sorry.
Yeah. How does nature allow you to feel? How do you feel after nature exposure? Your mood, your mind, what effects do you experience?
Well, it depends, actually. You could always say nature, we talk about nature is always good for us, but we also know nature is not always good for us. We have all kinds of phenomena in nature. But if we find a spot and a place where we feel safe, as you say, it can be really recharging and soothing, but also it is actually where we come from. So that's also something to connect back to as a human being. And nature is really important for me. And basically, often when we talk about nature, it's more or less outdoor, but always have to think about, we can always bring nature in as well. And we should actually do more of that as well. And nature meaning everything that is, it's like a whole ecosystem. So we need to think more than just green and plants. Stone, water, earth, fire, you name it.
Yeah, thank you. Gintare, what about you?
First, I want to say thanks for invitation, and thanks Gintare for mini therapy. And about question, I am lucky because I'm in nature, in the forest every day, and this helped me not become distant for it. And just later in my life, I realized that being in nature is not just pleasure, but also good for my health, for my inner balance, and most importantly, in nature I find answer to deeper question about myself, about my path in life, and it's give me peace, clarity, and yes, peace and clarity.
And I think that we all can relate to what you're saying, what you all shared. I think the audience can relate to that, to those positive effects that we experience in the natural surrounding. And Anna Maria, I want to invite you to share more about the context that you came from. What is the current state of using nature to improve citizens' mental health in Sweden? And maybe you could also share some good practice examples that we could learn from here in Lithuania.
Many people in Sweden live close by nature, and also many do not. For the good example, I would like to go very south of Sweden to Skåne, where I live and work, because the region in Skåne is actually the first one to implement nature-based healthcare as a part of the primary healthcare. And they have celebrated now 10 years offering this kind of healthcare in a collaboration with us, helping them to build the quality assurance system. It's the first one in the entire Nordic region. And the experience after 10 years is that even the social security that is actually paying for people on sick leave, they say this is probably the most important part we have, because we see such a change when people have had this opportunity. But this is not the therapy per se. This is an add-on to ongoing rehabilitation. So it's not replacing anything, but it's supporting it. And there are some other regions that are trying to implement this. Halland, our neighbor, has actually implemented. Blekinge, on the other side, is also trying to implement it. Around Gothenburg, they also can have some kind of this aspect. But I think, okay, this is in healthcare, but there is also very many strong forces for prevention and promotion as well. We have national organizations that are guiding people, bringing people out, helping schools to also include more nature. So I think we are up and running for more include of nature connectedness.
So it's part of the healthcare system in Sweden, right?
Skåne. South Skåne.
Oh,
yeah.
Specifically in Skåne.
Yeah, specifically in Skåne, because every region is controlling their own healthcare services, and therefore they are pioneers in this. And as I said, they celebrated last year 10 years. And yeah, we hope that will keep going and also inspire the rest of the country to do this, because they have a model that is functioning model that is easy to copy-paste.
Could you share some examples of what target groups, for example, the nature-based interventions are applied to, so we can better imagine what kind of context it is?
Yeah, in healthcare, it is more or less for depression and anxiety, stress-related mental disorder. Even the psychiatry is using nature-based interventions, and also where you have animals as well, equine-assisted dog therapy and so on. So mostly vulnerable population, children with learning disabilities, children with, we call it dropouts, the ones sitting at home, trying to revitalize and help the children to find the meaning and purpose through being in nature again and come back to school. And we have many very good examples of that, especially in Skåne. But this is also happening in the rest of Sweden, but it's not as well documented as down south with us. Yeah.
I feel we have a lot to learn from your examples here in Lithuania. And talking about Lithuania, Austa, sorry, how do you see the situation here locally? How do we implement or not implement nature? How do we integrate into our healthcare system? Do we use it for health promotion? How do you see the situation here?
I see it's very fast changing in the people mindsets, understanding, because 10 years ago, for example, people, yes, nature good for health, just that. But for example, when I doing lectures and they telling the numbers, how it prevents some disease or something like that, people, wow, I didn't know that, It's very fast changing, and not in the only in in the communities and so on, but also in the politicians' mindset. But mindset, that's not everything. Everything, to change the system, it's take much longer. So I see the changes, how people understand what nature can bring us, especially forests in Lithuania, because we call ourselves, forest nation. And but in the same times, we don't have understanding how to use that, For example, we Lithuanians, I don't know if every one of you knew, are very top on the depression and heart disease. And in the same time, research on forest therapy and nature-related activities shows that it's the best prevention for this disease, So we're doing something wrong, We don't know how to use the health benefits nature have. But I see very good going forward in Lithuania. For example, now nature therapy is official therapeutic, therapeutic healthcare. It is in a healthcare system, officially. Not implemented, but in the documents it is. Also, third year we have in Lithuania Health University post-diploma studies, and many students, every year about 40 students finishes. from different sectors. So it's going forward. This year it was very nice that in the studies 6 people from forestry sector come and studied. So my goal, my hope is that forest therapy and other nature health related activities will be implemented. For example, in forestry sector, in municipalities, health centers, and so on. And I see this trend very fast going. It's not, a very overall picture now how it is, but I think in few years it will be much more.
Okay, and Austi, you're also an environmentalist, so I also want to ask you, how do you think our country is doing with its conservation efforts, having in mind that it's very, very important both in terms of nature protection and our well-being?
I am quite a bit skeptical about that. I know that my colleague for forestry sector maybe will disagree with me, but we very fast we don't take, how to say, priority for the forests who are the best for our health, which are also the forests with the biggest, strongest ecosystem and so on. So we don't, in our forestry system, we don't see this as our priority, because it's mostly older forests, more like to the old growth forest type. It's not many of them. And now, because we don't calculate the value of how much, in the money-wise, nature bring us to the save our money from health system and so on. We're cutting the trees because of wood production, because we see it's only money we can bring. But I have amazing examples, and I wish for that Lithuania will have something like that. For example, Finland calculate overall it's a national policy that we calculate if they save forests and nature, how much money, it's like millions for years, we save from health system, because, for example, in 1 year we save €1.5 million for depression symptoms prevention and so on, because we are saving forests. So we need this calculation, and it's the way to protect the forests.
Yeah, and that's very important. That leads us to this question, how to balance all of those interests, right? And I want to bring this question to you, Gintarė, because as a representative from State Forest Enterprise, how do you see we can balance all those different interests, including health promotion and natural resource use, which we need to do as well? And so the nature is preserved, public interest is ensured, while at the same time ensuring economic benefits. It's really something we must do, but how do you see we can balance it all?
Yes, as a state forest company, our duty is to balance different interests and nature protection, public well-being, economic benefit, and expectations of societies. Yeah, and what we do. We follow the forest national standard and international certifications rules, who clearly set how forest should be preparing of biodiversity, of people, recreation, and what. And yes, the State Forest Enterprise has started to do activities with on the forest therapy, and it is not about medical treatment. They are more about spending time in nature, connection to the forest, and more challenge are still ahead.
Yeah.
Yeah, but it's one thing foresters have a negative image in societies today, and because of it will be important to build trust with people and to show that forestry also can help for setting well-being.
Can I add? Oh.
Sure.
You first.
Just short, now what we are trying, and I hope our forestry sector and environmental ministry agrees, now is the changing forest, like big forest document, and we're trying to implement one small change, which is one of many, but one small change, which is to, Lithuania have, if someone doesn't know, 4 types of forest, like for recreational use and so on, for protection, for wood extortion. So in the recreational part, we try to include a type of a forest which is healing forests. It's very short, small change that if we didn't, include the health forest, but we have it's only on the documents, it doesn't change anything. But I think it's also one step ahead to have more about health. Yeah.
Yeah, I think it's a really important question. It's not just saying, oh, let's go into the forest and everything is healing, because there are different components of forest, and as forest is not just a forest, it's a whole ecosystem, and you have different types of plantings, and especially when you have forest, more recreational forest, there are a lot of different users group with different wishes and users type. And for forest management, this is a very important issue to understand the healing properties or the restorative or contemplative properties that has to be implemented into the forest. And as you speak, SLU is actually part of European Action project, Green Me, where we actually have a PhD student particularly targeting this and working with a municipality in Stockholm who really wants to target this and actually see to all of those aspects, not just the user, but also environmental and biodiversity and so on, and see how can we model it so it benefits as much as everyone, and of course benefits nature as well. So it's not just, it is a dynamic, dynamic relation.
Yeah, and actually I have this question about what challenges we do face and what changes then we need. So you already mentioned some of them, but I want to come back to the healthcare sector. And Gintarė, I would like to ask you, from a legal perspective, how would you describe the current nature of forest therapy in Lithuania from this legal perspective, and how do we look in this broader context, for example, Europe? Can you share something about that?
Yeah, it's a very large question for me, because I provide lectures to our postgraduate studies training program of forest therapy at the Lithuanian University of Health Sciences, and it's a large question to explain in short way, but I try to do that. Yeah, we're talking about the law, legal perspective, and law. It's a tool. It's a regulator, helping assistance for people in our society to find the balance between different interests, and to create the legal rule. It's a long way, and sometimes the law. It goes after some phenomena, and sometimes legal reactions are too late to some situations. But if we're talking about the healthcare sector, it's very sensitive sector, yeah, because it's about the protection of patients' rights, about our most important elements in our life. It's our body, our minds, yeah, and And if we want to integrate officially in the existing systems, legal systems on health, so we need to do that in the good way, with the quality. And we are talking today about the nature-based interventions. And in principle, in general, it's not new methods. Yeah? It's because people lived with nature from ancient times, yeah? But now we're talking about, after the COVID pandemic, about after the burnt out situation, about very stressful situation in people's life, especially in professional level, we have new needs. We have new needs to help people to solve some health-related problems, and we need to have the way that could protect the patients. And so I could explain about the Lithuanian situation from legal perspective. We have special law for supplementary and and alternative health care. So it's special kind, it's not direct health care, as we know from the medical sphere. And we had this special law from 2020. It was adopted, and this law, it's a background for this type of services. And forest therapy, it's a part of one of the this additional supplementary alternative services group, but it's not from the psychological part, but it's founded from biological backgrounds, and it goes together with phytotherapy, with endobiogenics as well, and other. Sorry for terms, I'm not from medicine sector myself.
We're not the experts too, so it's okay.
Yeah, sorry, I'm from social science more, and this law also was amended by other document, and this year by Ministry of Health was adopted medicine norm for forest therapist activities. So it's something like national standard for that. And this document describes what means forest therapy. We have a term, we have the description, the notion of this services. Also, this law provide double, or how to say, dual licensing system. So it means that forest therapy as a service in health sector could be provided just by legal entity having a special type of license for forest therapy activities. And in practice, when the patient goes to this institution, licensed institution, so the specialist forest therapist, also the special qualification in our legal framework that we have, also this specialist must have the license for this activity of forest therapy. But in practice, so I checked today the register of license. So we have at this moment, so program of university has during 3 years. So we have around 150 people, participants, finished this program, and just 36 specialists are with a license for today. And how many institutions, what do you think, with license today? Maybe
A lot?
audience. You have the answer. A lot? No, it's 0. Yeah, because it's a time, all it goes on progress, and we need a time for prepare the health system for this new kind of services, because legal entities, so they should provide some requirements and conditions like obligatory liability insurance as well. So a lot of structural changes needed for this sector, but so we are happy that we have it. And you asked me about the examples in other countries, so in Europe, so it's very fragmented.
Okay.
And it depends on people who started this movement of nature or forest therapy. And for example, if we are talking about South Korea, so it's long history of the process of this forest therapy implementation, integration in the policy strategies. But in South Korea is a part of forest policy. It's like this. In Lithuania, we started from the health sector. In Slovenia, we have situation when it was started from tourism sector. Maybe there are some countries where it was started from educational sector, and in Germany, for example, there are some specialized clinics with specialization for forest therapy issues, with special healing trails as well in Finland. Yeah, and so it's very fragmented, and we don't have the common European Union policy on this issue. So, but I have research on forest therapy regulation, and we will see, because it's related to the freedom of workers as well in EU. So it's very important. Yeah, and challenges. I think it's the biggest challenge is the lack of interdisciplinarity in this sphere.
Okay,
Sorry
and
for a long
no, it's okay.
perspective.
Tara mentioned already one important thing, that we, among other important things, that we have the legal regulation already, but we don't have licensed institutions that could provide this to be implemented in practice. What other changes do we need? What do you think, Austa? What do you think we still need to cope with those challenges?
I just going through examples through different countries. I see what different countries have, and as Gintara mentioned, Korea is the best example how country level, governmental level implementing forest therapy and so something on. They have very good infrastructure for that, forest therapy centers in each region and so on. In small country, I think 20 or something like that, forest therapy centers. I'm not sure about the number, I need to check. For example, Canada has an amazing program. We created it, I think, in the COVID 3 years ago or 4 years ago. It's a platform for doctors for nature prescription. But it's a quite difference, because in Canada, national parks are quite expensive to go in. It's not like €1 like in Lithuania. So doctors prescribe nature activities for the patient through that platform, and patient give free entrance to the parks. So, it's benefiting, and for the patients, it's more, appealing, to come, because it's free entrance, and I use it and do something in the park. But also, it's an amazing platform for the doctors, because, for example, last year I heard in Italy was the research done how doctors see the nature therapy or nature-related activities for health, and if they are willing to recommend it to the patients. So, for example, yes, the doctors are willing, but if the research was done exactly in that forest, they will send the people here. So we need very, exact place. So it's very strange, but I think one of the best ways also to have education for the doctors, to have for him to bring the tools, how it's working, how nature affects and so on, and it will spread much faster. There are also many examples, but I don't want to.
Okay. So education for doctors and
education for doctors. Also another thing, Lithuania could go to the nature health activities through tourism sector also.
Okay.
Because, for example, now Lithuanian Keliauk Lietuvoj agency seeing that health tourism in Lithuania are growing, but we're seeing mostly through the mineral waters, mud, and so on, what is happening in the spa centers. But they didn't see as healing abilities for nature itself and promoting it as tourism sector,
Okay, yeah.
So we have opportunity. Foreigners see it, that Lithuania has it. We have dark sky. We can have dark sky tourism. We can have silence tourism. People are overloaded, and it's my goal that to see that Lithuanians and foreign people to see Lithuania as healing forest center in Europe. It's my vision, and I see it's possible to
That's
have.
very interesting to better integrate the tourism sector. Anna
Yeah.
Maria, what about you? Any
No.
suggestions?
No, we talk more afterwards. I want to know more about this legalization. But I think it's really important to think about, are we talking prevention or promotion or rehabilitation? Because, for example, in Sweden, when we say we have guided forest bathing, that means that's some prevention promotion. But once you have the word therapy, you need to have a certified practitioner running it. Otherwise, you cannot use the word therapy. So it's really important. And everyone in Sweden that has then legalized and a legalized practitioner in different health sector, you actually can bring your clients outdoors, forest, nature in any type, or garden, or whatever, beach. But you are always responsible for your client. So we need to also think about, there are different user groups and responsibilities once you are working with people. But I like the idea and would like to learn more about that. It is actually kind of official registration and what's the qualification of being registered. I think that's one step forward. But I think today we talk about so much of forest. Of course, we have a lot of forest, but it has been a long tradition, especially in our region here, is actually to be outdoors, be in nature, nature outdoor schools, often in forest or in the shelter of trees. So we cannot, I feel we're kind of losing the sight of what we actually have and what our tradition is in this really buzzword of forest bathing. So kind of step back and say, we have a lot of other things that we can promote and have a long experience of.
Yeah, that's very important.
Yes, I think that cooperation between all sectors is very important, and I mean forestry, health, education, legal system. And from the side of the state forest enterprise, we want to give more attention to the health and social functions of forest. And yes, we already have 7 people who have finished nature and forest therapy in the university at Lithuanian University of Health Science, yes. Yes. And we want to keep learning, to see what societies needs, and to look ways how to prove it.
Okay, and I personally found it really surprising that Lithuanian Forest Enterprise has really started to do those practices of forest therapy. Gintare wanted to react, right?
Yeah, I wanted to add something about the requirements if you want to become a forest therapist, I think that this method, nature-based method, is very adaptable in various spheres. And as I said, we have 36 licensed specialists in the register, but we have other people who finish this studies, and also we will have more because it's very popular training program now in Lithuania. So I'm sure that we will have more, and it's very nice because people could adopt this nature-based method to each background profession. For example, if we have from forest sector workers, so they adopt in their working activities. If we have teachers from schools, from kindergarten, so they will help for this kind of audience, potential users, yeah?
But they don't call themselves forest therapists.
Yeah, yeah, and from the legal perspective, if you ask me, okay, please tell, forest therapy and forest bathing is the same or not? Because I received this question, so and it's not true. It's not the same, and the lawyer will say that no, it's not the same thing because we have a law, and I think that I didn't find the data about other countries. About adoption of special law on supplementary and alternative, like folk medicine, with folk medicine issues, healthcare laws. So I think that Lithuania is the first in this way, and also I think that it's very important to share and to collaborate with people from different fields, because it helps to create new methods, new tools for people according to our needs from interdisciplinary area.
And thank you for the opinions. For now, I still have a finalizing question for you all, but I also want to involve the audience. We have a microphone for the audience, so I would like to ask you, if you have a question, just raise your hand. It would be nice to hear your name and whom you address the question. Maybe it's for all or for some panelists in particular, and your question briefly. So who would like to ask or comment maybe? Yes.
My name is Vida, and I would like to ask Anna Maria about a concrete case, how a patient is prescribed this therapy, and also how is he guided by a therapist. Also the same question could be to Auste, if these licensed forestry therapists have ever rendered this kind of service, or if there were any patients getting this kind of service therapy. It's to both, to Anna Maria and also to to Gintare. I'm sorry.
Okay, I can give you two examples. One is from Stockholm, where is a psychologist that has been working with forest bathing and forest therapy for many years and educating. There, the healthcare unit can refer directly to her. She is collaborating, so they can refer directly to her, and then they can choose if it's bathing or therapy. But and that's not really kind of anchored in the entire system, but it's a collaboration between the unit and the person. And of course, he has her license and all the responsibility as a psychologist. And again, back home in Skåne, There it is rooted in the system. It's part of the system. That means as any other alternative the doctor wanted to prescribe, he just sent it into the system, and the system sent it on to the provider of nature-based intervention, as he would send it to some other activities. So it's embedded in the system, and as well is the payment. So the payment to whatever you choose is also from the regional government. And that means once this is knitted in the system, any of the healthcare units can use this service, because you don't have to do something extra. And I think that's the key to really get this in practice, is that it's not just between the specific unit and the service provider, but it's within the system and using the internal way of prescribing regardless.
If I understood well, your question was how to come to the licensed specialist, yeah? As I mentioned, just in May of this year, the Ministry of Health was adopted necessary legal documents, medicine norm, medicine standard for forest therapist activities and services, and the sector waited this regulation very much, many years from the adoption of the law in 2020, because if you want to provide something, you need to know the rules of game, you know, if you want to play some game. And now it's the summertime, and I think that it is the interest from rehabilitation centers, from sanatories, the interest to implement this method in everyday practice, everyday services as one of the kind of group of other services for health and well-being, so we are on the progress. But in other hand, we have the people who has a knowledge on forest therapy with methods, essential methods, and they apply that in everyday practices. For example, if you want to find the specialist with license, you could go to the special institution website. There the open register, and you could find the names with people who is, because it's open for society to know that, and you could contact with them, but we still need to wait the institution with forest therapy license, if we could say that, yeah, it's a forest therapy service as a supplementary and alternative health care services according to the law. So we need just to wait a little bit.
Actually, we have an example of the third model in Sweden. It's the, as I say in Swedish, Västra Götaland region, that is around Gothenburg. So they actually run a health garden with at least 4 or 5 registered healthcare practitioners. And if you're employed by the region, you can be referred there. Both in prevention, because you're in the risk zone, working too much, Anna Maria, now I would think we need to help you to settle down, or I'm heading for a sick leave, then as an employee, having an employment with the region, I can also use this garden. So actually the entire region is using the garden for this stuff. So that's also one model, or one way to go, is that you do it for the municipality or the region as well.
Thank you. And we have time for very very brief question and very brief answer. So maybe we have such a question.
Well, I'm not sure if it qualifies, but hopefully, yeah. I'm Elizabeth. I'm a psychologist. This goes to all of you. Is there a risk that by having this nature therapy and so on, that we medicalize or commodify nature in a way? And if so, how should we address that?
Yeah, that's a very good question. Very briefly, how would you answer? It was thought-provoking, obviously.
Could you summarize, please, the question?
By moving towards this nature therapy integration, would we medicalize nature in a way? Am I right?
Yeah. Mm-hmm. I could read.
Yeah.
So I think that to be in nature, with nature, is our choice. And it's very, it depends on personalities, it depends on times, it depends on age of people. And for me, for example, I don't need, rule or law to be in nature. Nature, it is in my heart. So, but there are some people who need, some how to say, some special supporting, some special programs, special financial support to test something, and it depends on people, and I would like that we will have the wild nature, wild as possible wild, not to create additional, infrastructure, and not to reconstruct the nature, because nature itself is very rich, and in my opinion, so we have enough in our nature, especially in Lithuania.
I didn't see that it could become a problem at all. Because when people, for example, if doctor prescribed nature therapy or other related nature-based activity, people, for example, if a forest therapist, forest therapy guide come to the nature, and they come because they don't, for example, like big depression or cancer or something more terrifying, and they get the tools how to be different in nature. They see what benefits it brings in a few hours, and they will use it more, like they will know how to be in nature, find more connection with nature, not only go when doctor prescribe and go with a therapist. I see only benefits, and also when I lead forest bathing sessions, I tell to people, you now coming with me, I am showing you the tools, but my goal is that you come tomorrow by yourself, and know how to relax and how to be in nature here and now. So I don't see that it would be a problem. Opposite, it will be like for many people, doctors are, very, like, how to say, people who to look to, and listen to. So it will be more push for people who are not very really into believing that nature can help.
Thank you for this. I think it's really important to bring this with us and not lose the sight of what you said and asked about. Hopefully we will not get there, but we need to be aware of it. So it's a good point we need to consider. And again, I have experience in seeing in Sweden that a lot of practitioners wants to go out with the clients, they do it, and they also say that a kind of different therapeutic alliance is forming than when you're indoor. And they want to see it as a possibility to say, okay, do we go out or are we indoors? And not choosing only out or in. So we should maybe more aim for this integration of indoor-outdoor in a different ways. But this is very important to bring with us.
Yeah, thank you very much. And unfortunately, we don't have time for this finalizing question. So I really just want to thank you very much. And to wrap up in a way, I've heard a lot of challenges that you mentioned, but also a lot of opportunities. So I really want to believe that we can move towards the realization of those opportunities. So thank you very much for sharing your expertise, your views, and thank you very much for listening to us, for asking questions. And ačiū.